Good day everyone, I am Pearl J. Tarnate together with my group mates Ms. Hans J. Atisado, Ms. Glidel Pungaron, Ms. Maria Cristin Duero, and Ms. Marimel Fernandez. And we are going to discuss chronic illnesses, which include asthma, diabetes, epilepsy, and allergies. So what is chronic illnesses? Chronic illness lasts a long time, often for a year or more. You may also have a need for ongoing medical care and difficulties doing the things you need to do every day. These behaviors, called activities of daily living, include things like using the toilet and getting dressed. These difficulties can also affect your family and school activities. It is said that students with chronic health conditions can function to their maximum potential if their needs are met. The benefits to students can include better attendance, improved alertness and physical stamina, fewer symptoms, fewer restrictions on participation in physical activities and special activities, such as field trips, and fewer medical emergencies. School can work together with parents, students, healthcare providers, and community to provide a safe and supportive educational environment for students with chronic illnesses, and to ensure that students with chronic illnesses have the same educational opportunities as other students. Now let's talk about the different kinds of chronic illnesses. Let's start with asthma. What is asthma? Asthma is a chronic condition that affects the airways. It causes wheezing and can make it hard to breathe. Some triggers include exposure to an allergen or irritant, viruses, exercise, emotional stress, and other factors. Asthma is a long-term condition affecting the airways. It involves inflammation and narrowing inside the lungs, which restricts the air supply. It is a chronic inflammatory condition that causes swelling in the airways. It can affect people of any age, and the symptoms can range from mild to severe.
And there are types of asthma. First is the childhood asthma. Asthma is the most common chronic condition in children. It can develop at any age, but it is slightly more common in children than in adults. In 2017, children aged 5 to 14 years were most likely to experience asthma. In this age group, the condition affected 9.7% of people. It also affected 4.4% of children aged 0 to 4 years. In the same year, asthma affected 7.7% of people aged 18 years and over. Some common triggers of childhood asthma include respiratory infection and colds, cigarette smoke including secondhand tobacco smoke, allergens, air pollutants including ozone and particle pollution both indoors and outside, exposure to cold air, sudden changes in temperature, excitement, stress, and exercise.
Second, adult onset asthma. Asthma can develop at any age, including during adulthood. According to 2013 study, adults are more likely than children to have persistent symptoms. Some factors that affect the risk of developing asthma in adulthood include respiratory illness, allergies and exposure to allergens, hormonal factors, obesity, stress, and smoking. Third is the occupational asthma. This is exposure to an allergen or irritant present in the workplace. In the following workplaces, allergens may cause asthma in those with a sensitivity or allergy, such as in bakeries, flour mills, and kitchens, in hospitals and other healthcare settings, pet shops, zoos, and laboratories where animals are present, farms and other agricultural settings, and there are also occupation irritants that can trigger asthma symptoms such as car repairs and manufacturing, engineering and metalwork, woodwork and carpentry, electronics and assembly industries, hairdressing salons, and indoor swimming pools.
Those with a higher risk include people who smoke, have allergic rhinitis, and those who have a history of asthma or environmental allergies. Fourth is the difficult to control and severe asthma. Severe asthma refers to asthma that does not respond well to regular asthma treatments, such as inhaled corticosteroids and inhaled bronchodilator medications. Severe asthma is relatively uncommon, generally affecting 5 to 10% of people with asthma. Some people have severe symptoms for reasons that do not relate directly to asthma. For example, they may not yet have learned the correct way to use an inhaler. Others have severe refractory asthma. In these cases, the asthma does not respond to treatment, even with high dosages of medication or the correct use of inhalers. This type of asthma may affect 3.6% of people with the condition according to one 2015 study. Fifth is the eosinophilic asthma. It is another type of asthma that in severe cases may not respond to the usual medications. Although some people with eosinophilic asthma manage with standard asthma medications, others may benefit from specific biologic therapies. One type of biologic medication reduces the numbers of eosinophils, which are a type of blood cell involved in an allergic reaction that can trigger asthma.
And lastly is the seasonal asthma. This type of asthma occurs in response to allergens that are only in the surrounding environment at certain times of year. For example, cold air in the winter or pollen in the spring or summer may trigger symptoms of seasonal asthma. People with seasonal asthma still have the condition for the rest of the year, but they usually do not experience symptoms. And now let's move on to the causes and trigger of asthma that will be discussed by Ms. Tisado.
So there are causes and triggers of asthma. First is pregnancy. According to one study, smoking during pregnancy appears to increase the risk of the fetus developing asthma later in life. Some women also experience an aggravation of asthma symptoms while pregnant. Second is obesity. One article from 2014 suggested that there seem to be higher levels of asthma in people with obesity than those without it. The authors note that in one study, children with obesity who lost weight also saw improvements in their asthma symptoms. There is now a growing body of evidence suggesting that both conditions involve a chronic inflammatory response, and this could explain the link. Third, allergies. Allergies develop when a person's body becomes sensitized to a specific substance. Once the sensitization has taken place, the person will be susceptible to an allergic reaction each time they come into contact with the substance. Not every person with asthma has an allergy, but there is often a link. In people with allergic disease, exposure to specific allergens can trigger symptoms. One 2013 study found that 60 to 80% of children and young adults with asthma are sensitive to at least one allergen. Fourth is smoking tobacco. Cigarette smoking can trigger asthma symptoms according to the American Lung Association. Asthma, even without smoking, can cause damage to the lungs. This can increase the risk of developing various tobacco-related lung conditions, such as chronic obstructive pulmonary disease, and it can make symptoms more severe. Fifth is environmental factors like air pollution, both inside the home and outside of it, can affect the development and triggers of asthma. Some allergens inside the home include mold, dust, animal hair and dander, fumes from household cleaners and paints, and cockroaches and feeders. Other triggers in the home and outdoors include pollen, air pollution from traffic and other sources, and ground level ozone. 6 is stress. Stress can give rise to asthma symptoms, but so can several other emotions like joy, anger, excitement, laughter, crying, and other emotional reactions can all trigger an asthma attack. Scientists have also found evidence to suggest that asthma may be more likely in people with mental health conditions such as depressions. Others have suggested that long-term stress may lead epigenetic changes that result in chronic asthma. 7th is genetic factors. There is evidence to suggest that asthma runs in families. Recently, scientists have mapped out some of the genetic changes that may play a role in its development. In some cases, epigenetic changes are responsible. These occur when an environmental factor causes a gene to change. 8 is hormonal factors. Around 5.5% of males and 9.7% of females have asthma. In addition, symptoms may vary according to a female's reproductive stage and point in the menstrual cycle. For example, during the reproductive years, symptoms may worsen during menstruation compared with other times of the month. Doctors call this perimenstrual asthma. During menopause, however, asthma symptoms may improve. Some scientists believe that hormonal activity may impact immune activity, resulting in hypersensitivity in the airways. 9th, for physical exam asthma. The doctor will focus on the upper respiratory tract, the chest, and the skin. They will listen for signs of wheezing, which can indicate an obstructed airway and asthma. They will also check for a runny nose, swollen nasal passages, any growths on the inside of the nose, and they will also check the skin for signs of eczema or hives. For asthma test, first is the doctor may also carry out a lung functions test to assess how well the lungs are working. Second, a spirometry test is one example of a lung function test. The person will need to breathe in deeply and then breathe out forcefully into a tube. The tube length up to a machine called a spirometer, which shows how much air a person inhales and exhales, and the speed at which they expel the air from the lungs. Third, the doctor will then compare these results with those of a person who is similarly aged but who does not have asthma. Fourth is to confirm the diagnosis. The doctor may then give the person a bronchodilator drug to open the air passages and repeat the test. If these second results are better, the person may have asthma. Fifth is this test may not be suitable for young children. However, instead, the doctor may prescribe asthma medicines for 4 to 6 weeks and monitor any changes in their symptoms. For the other tests for diagnosis include: first is a challenge test. This test allows a doctor to assess how cold air or exercise affect a person's breathing. Second, a skin prick. A doctor can use this test to identify a specific allergy. Third, test to rule out other conditions like sputum test, x-rays, and other tests can help out sinusitis, bronchitis, and other conditions that can affect a person's breathing. Second is a skin prick. A doctor can use this test to identify a specific allergy. Third is tests to rule out other conditions like sputum test, x-rays, and other tests can help rule out sinusitis, bronchitis, and other conditions that can affect a person's breathing.
Diabetes. What is diabetes? Diabetes is a disease that occurs when your blood glucose, also called Blood sugar is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get in your cells to be used for energy. Sometimes, your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. There are different types of diabetes. Type 1 diabetes, Type 2 diabetes, and gestational diabetes. Type 1 diabetes. If you have type 1 diabetes, your body does not make insulin. Your immune system attacks and destroys cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear in any age. People with this type of diabetes need to take insulin every day to stay alive. Type 2 diabetes. If you have type 2 diabetes, your body does not make or use insulin well. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes. Gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you'd had gestational diabetes, you have a great chance of developing type 2 diabetes later in life. How common is diabetes? As of 2015, 30.3 million people in the United States, or 9.4% of the population, had diabetes. More than 1 in 4 of them didn't know they had the disease. Diabetes affects 1 in 4 people over the age of 65. About 90 to 95% of cases in adults are type 2 diabetes. What health problems can people with diabetes develop? Over the time, high blood glucose leads to the problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems.
Thank you, Ms. Duero. And now, let's proceed to my topic where I will discuss to you what is epilepsy as one of the chronic illnesses. Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy. Epilepsy affects both males and females of all races, ethnic backgrounds, and ages. For those who didn't know what is epilepsy, there is a short clip that I will show to you in order to have some ideas what it is all about. As you can see in the video, a person is having a seizure while she's busy cleaning their kitchen. It is impossible to predict when and how long seizure symptoms will come and last. Some people with epilepsy simply stare blankly for a few seconds during a seizure. Seizures sometimes can last a few seconds to several minutes. During a seizure, some people become confused or lost consciousness. They may also feel twitches in their arms or legs. Afterward, you may have no memory of it happening. Having a single seizures doesn't mean you have epilepsy. At least 2 seizures without a known trigger or unprovoked seizures that happen at least 24 hours apart are generally required for an epilepsy diagnosis. So let's move on to epilepsy facts, data, and statistics. Epilepsy is a fairly common neurological disorder that affects millions of people around the world. As what I've said earlier, anyone can develop epilepsy, but it's more common in young children and older adults. It occurs slightly more in males than in females. There is no cure for epilepsy, but the disorder can be managed with medication and other strategies. In 2015, the CDC stated that epilepsy affected around 1.2% of the United States population, that amounts to approximately 3.4 million people, including 3 million adults and 470,000 children. The World Health Organization, or WHO, estimate that epilepsy affects approximately 50 million people worldwide. Have you ever asked yourself, what are the causes of epilepsy? Yes? Then let's go deeper to find out the possible causes of epilepsy. There are around 180 new cases of epilepsy each year. About 30% occur in children. Children and elderly adults are the one most often affected. There are clear causes of epilepsy in only a minority of the cases. Typically, the known causes of seizure involve some injury to the brain. Some of the main causes of epilepsy are family history, injury before, during, or soon after birth, head or brain trauma, brain condition, infectious disease, and developmental disorder. So let's proceed to family history. Gene play a big part, as many as 40% of all epilepsy cases happen because the person with it has a genetic makeup that makes them more likely to get it. There isn't just one gene behind epilepsy. In fact, some experts think there may be as many as 500. If you have a parent or a sibling with epilepsy, you have a higher chance of getting it than someone who doesn't. Doctors aren't sure how it passed down, but they think it may have something to do with a gene mutation that affects nerve cells in the brain. It's also possible to have this mutation and never get epilepsy. Experts also think the combination of genetic and something else like medical condition may be to be blamed. The second one is injury before, during, or soon after birth. Any problems with brain development in the womb or in early infancy case raise the chance of epilepsy. Brain damage can happen to babies in the womb for many reasons, including an infection in the mother, poor nutrition, and too little oxygen. If there are problems during birth, or if a baby is born with brain defects, this can also bring on epilepsy. The third one is head or brain trauma. Either can trigger seizures. Sometimes they go away. If they do, you don't have epilepsy. However, if they continue, that's a sign that you have post-traumatic epilepsy or PTE. It can also happen during birth. You may not get epilepsy until long after your brain injury, sometimes years later. The fourth one is brain conditions. Most cases of epilepsy in people older than 35 happen because of brain damage or stroke or even after brain surgery. Other brain problems that can trigger epilepsy include tumor, blood vessel problems like the hardening of your brain arteries, stroke, Alzheimer's disease, and tuberous sclerosis, a genetic condition that can cause growths in the brain. The fifth one is infectious diseases. Conditions caused by a viral or bacterial infection can cause epilepsy, especially if they infect your brain. Some common culprits are AIDS, viral encephalitis, and meningitis. And lastly, developmental disorders. It could also caused by how the brain itself developed in the womb. Certain disorders raise your chance of epilepsy, including Down syndrome, autism, neurofibromatosis, a genetic condition that causes non-cancerous tumors to grow on nerve coverings. In up to 70% of all cases of epilepsy in adults and children, no cause can be discovered. So let's move on to what are the symptoms of epilepsy. Seizures are the main symptoms of epilepsy. Symptoms differ from person to person and according to the type of seizures. Doctors can sometimes identify the cause of a person's seizures. There are two main types of seizure based on whether or not they can determine the cause. The idiopathic or cryptogenic and symptomatic. The idiopathic or cryptogenic, there is no apparent cause or the doctor cannot pinpoint one. While the symptomatic, the doctor knows what are the causes. There are also three seizure descriptors: the partial, generalized, and secondary generalized, depending on which area of the brain seizures originate in. So, the partial seizure occurs when the epileptic activity takes place in one part of a person's brain. There are two subtypes of partial seizure: the simple partial seizure and the complex partial seizure. The simple partial seizure, it is during this type of seizure, the person is conscious. In most cases, they are also aware of their surroundings, even when the seizure is in progress. While the complex partial seizures, during this type, the seizure impairs a person's consciousness. They will generally not remember the seizure. If they do, their memory of it will be vague. The second seizure descriptors is generalized seizure. A generalized seizure occurs when the epileptic activity affects both halves of the brain. The person will usually conscious while the seizures is in progress. There are several subtypes of generalized seizure, including tonic-clonic seizures, which perhaps the best known type of generalized seizure. Tonic-clonic seizures cause loss of consciousness, body stiffness, and shaking. Doctors previously called this grand mal seizure. Symptoms include stiffening of the body, shaking, loss of bladder or bowel control, biting of the tongue, and loss of consciousness. Second one is the absence seizures. Previously known as petit mal seizures, these involve short lapses of consciousness wherein the individual appears to be staring off into space. Absence seizures often respond well to treatment. Next is tonic seizures. In tonic seizures, seizures, the muscles become stiff and the person may fall. The fourth one is atonic seizures. A loss of muscle tone causes that individual to drop suddenly. Fifth, clonic seizures. The subtype causes rhythmic, jerking movements, often the pace or. Sixth, the myoclonic seizures. This subtype causes the upper body or leg to suddenly jerk or twitch. The secondary generalized seizure or the last seizure descriptors. A secondary generalized seizures occurs when the epileptic activity starts as a partial seizures but spread to both halves of the brain. As this seizure progresses, the person will lose consciousness. So here are the tips that may help reduce your risk of having an epilepsy seizure. First, get plenty of sleep each night. Set a regular sleep schedule and stick to it. Second one, learn stress management and relaxation technique. Third, avoid drugs and alcohols. Fourth, take all of your medications as prescribed by your doctor. Fifth, avoid bright, flashing lights and other visual stimuli. Sixth, skip TV and computer time whenever possible. 7. Avoid playing video games. And last, seizure prevention tips is eat a healthy diet. Until more is known about the causes of epilepsy and how it can be prevented, your best bet to prevent seizures associated with epilepsy is to avoid the things that can trigger your seizures. This can make a measurable differences in the number of seizures you have.
Good day everyone, I am Marimel Fernandez, the last reporter for this video lesson. My topic is about allergy, and in this topic I will share with you what is allergy, its symptoms, causes, common triggers, complications, and its preventions. So what is allergy? Allergy is an abnormal reaction of the body to a previously encountered allergen introduced by inhalation, ingestion, injection, or skin contact, often manifested by itchy eyes, runny nose, wheezing, skin rash, or diarrhea. Allergies occur when your immune system reacts to a foreign substance, such as pollen, bee venom, or pet dander, or a food that doesn't cause a reaction in most people. The severity of allergies varies from person to person and can range from minor irritation to anaphylaxis, a potentially life-threatening emergency. While most allergies can't be cured, treatments can help relieve your allergy symptoms. Symptoms of allergies. Allergy symptoms, which depend on the substance involved, can affect your airways, sinuses and nasal passages, skin and digestive system. Allergic reactions can range from mild to severe. In some severe cases, allergies can trigger a life-threatening reaction known as anaphylaxis. Here are some allergies and their symptoms. First is hay fever, or also called allergic rhinitis. It's an allergic reaction to pollen. It can cause sneezing, itching of the nose, eyes or roof of the mouth, runny, stuffy nose, watery, red or swollen eyes. Second is the food allergy that can cause tingling in the mouth, swelling of the lips, tongue, face or throat, hives, and anaphylaxis. Third is an insect sting allergy that can cause a large area of swelling or edema at the sting site, itching or hives all over the body, cough, chest tightness, wheezing or shortness of breath, and anaphylaxis. Fourth is a drug allergy that can cause hives, itchy skin, rash, facial swelling, wheezing, and of course, anaphylaxis. Fifth is atopic dermatitis, an allergic skin condition, also called eczema, can cause skin to itch, redden, flake, or pee. Anaphylaxis. Some types of allergies, including allergies to foods and insect stings, can trigger a severe reaction known as anaphylaxis. A life-threatening medical emergency, anaphylaxis can cause you to go into shock. Signs and symptoms of anaphylaxis include loss of consciousness, a drop in blood pressure, severe shortness of breath, skin rash, lightheadedness, a rapid weak pulse, nausea, and vomiting. So what are the causes of allergy? An allergy starts when your immune system mistakes a normally harmless substance for a dangerous invader. The immune system then produces antibodies that remain on the alert for that particular allergen. When you're exposed to the allergen again, these antibodies can release a number of immune system chemicals such as histamine that cause allergy symptoms. So common allergy triggers include airborne allergens such as pollen, animal dander, dust mites, and mold. Certain foods, particularly peanuts, tree nuts, wheat, soy, fish, shellfish, eggs, and milk. Insect stings, such as from a bee or wasp. Medications, particularly penicillin or penicillin-based antibiotics. Latex or other substances you touch, which can cause allergic skin reactions. What are the complications of allergy? Having an allergy increases your risk of certain other medical problems, including, first, anaphylaxis. If you have severe allergies, you're at increased risk of this serious allergy-induced reaction. Foods, medications, and insect stings are the most common triggers of anaphylaxis. Second, asthma. If you have an allergy, you're more likely to have asthma, an immune system reaction that affects the airways and breathing. In many cases, asthma is triggered by exposure to an allergen in the environment or allergy-induced asthma. Third, sinusitis and infections of the ears or lungs. Your risk of getting these conditions is higher if you have hay fever or asthma. Prevention of allergy. Preventing allergic reactions depends on the type of allergy you have. General measures include the following. First, avoid known triggers. Even if you're treating your allergy symptoms, try to avoid triggers. If, for instance, you're allergic to pollen, stay inside with windows and doors closed when your pollen is high. If you're allergic to dust mites, dust and vacuum and wash bedding often. Keep a diary. When trying to identify what causes or worsens your allergic symptoms, track your activities and what you eat, when symptoms occur and what seems to help. These help you and your doctor identify triggers. Wear a medical alert bracelet. If you have had a severe allergic reaction, a medical alert bracelet or necklace let others know that you have a serious allergy in case you have a reaction and you're unable to communicate. And that is all for my topic. Thank you for listening.